An important query. COVID triggered an urticarial type of hives reaction in a family member. I remember referring one of my friends in Shumaga to your clinic, exactly the same. So that lady was having allergic dermatitis and allergic rhinitis related symptoms post COVID vaccine. I inflamed. So this is COVID triggered, not vaccine triggered. So COVID triggered an urticarial type of hives reaction in a family member, inflamed widespread Ketadamsha type of raised rashes. How is this virus, which is typically causing respiratory distress, causing such a diverse reaction? What can we do in terms of medicine and diet to heal from this, sir?
See, we need to understand certain things. When in a fetus, at the time of growing, the skin and respiratory system develops from same germinal layer. So because of that, skin as well as respiratory system is just like brothers. So whenever your inflammatory condition or allergic manifestation takes place in respiratory system, soon there will be something may be triggered, or if you suppress there in this respiratory system, it may get triggered in the skin. So it's very common notion and it is very commonly seen. So and even if you observe in both the conditions, we try to give the same type of medication which will suppress the allergic reactions even in the respiratory system as well as in the skin layers. So it is very typically they are very closely they are developed and their origin is almost similar or moola is same. So because of that reason they behave in a similar fashion.
Regarding line of treatment or how to go about it, probably panchakarma therapy or probable medicines.
See, I would like to clarify here. Many a times the people are just fond of panchakarma, panchakarma, panchakarma. See, very clearly it is very said where to do panchakarma. There are only two occasions. One is seasonal cleansing, detoxification. Here, dosha becomes bahudoshatva because of the onset of or continuous dinacharya, rutucharya effect on the body throughout the season. Ultimately, in that particular season, we need to go for, even though we are healthy, these lakshanas are there, are to avoid those complications in future, anything, we go for a seasonal cleansing, detoxification. Otherwise, when a patient comes to us, very clearly we need to assess there will be bahudoshata. If there is a bahudoshata, then you can go for panchakarma or shodhana therapies. Otherwise, if it is not bahudosha and the condition or symptoms are not alarming, there is no need to go directly into shodhana procedure. You can straight away use Shamana, effectively Shamana treatments also. But when the person is suffering from these type of allergic reactions and causing a severe distress, then we can go for Sadhyo Vamana or Sadhyo Virechana. So in this case, if there is a lot of itching is there, then you can go for Sadhyo Vamana, not the traditional way of giving Grutapana and all those things continuously, then after that going for proper Vamana or Virechana, not like that. It is Sadhyo Vamana or Sadhyo Virechana. That will definitely suppress the vega of itching.
And a few medicines which could be useful in this condition, please.
Definitely, one of the important material which can be used for these allergic type of disorder is Kadrarista. And if you suspect there is an involvement of Krimi, then there is a Vidangarista. Then along with that, you can go with Bruhat Haridra Kanda. These drugs will definitely give sufficient relief in itching and allergic manifestations. Particularly Kadira and Asana, Kadira. These are very important drugs.
Yeah, I mean, when you posted a WhatsApp group regarding a successfully treated psoriasis patient, it's very difficult for people to believe that such a tremendous results can be done or achieved only through oral medicines. And somebody asked whether Virechana was done, and you said no, or any Panchakarma was done, you said no. And at least somebody asked, like, at least did you do Deepana Pachana? I mean, probably the greatest lesson that I learned from you is that just with Shamana Ausadhis or the palliative medicines, if you pick the right ones, they can be the biggest weapons as well.
Definitely. See, in my cases, what I usually do is stick on to certain specific drugs and very strict diet control. If you don't advise the diet control, you will not get the result, particularly in skin conditions as well as in asthma type related or allergies or even diabetes or even liver disorders. In these conditions, if you don't prescribe a very stringent diet pattern, definitely they will be simply eating whatever they get it, and ultimately they said, I didn't get relief. If you want to have a relief and the best results, then make them to follow a very typical diet pattern, avoid all those unwanted things, and then proper drug selection to based on his body weight, is vegetarian or non-vegetarian, and it is agni and everything. What we try to analyze during when we take history taking from the patient, these things can be analyzed, and accordingly we can go for a treatment and selection of drugs.